Hi, I'm Dr. Nichelle Haynes,
I'm Dr. Kristen Lassiter,
and we're Medical Mamas. This is your place for evidence-based information about your reproductive mental health.
meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
I think today is a really important topic because it's so common.
So common, and there's a lot of stigma around it or a lot of shame around it too.
So we're going to be talking about perinatal loss, miscarriage, infant loss, even related to things like embryo loss or failed fertility treatments.
Yeah. So I think we should start off just explaining that there are a lot of really common things that people go through after experiencing perinatal loss that can sometimes feel very isolating.
Right. And like we said, this is a very common experience that people have in response to an event like this.
So some of the common things that people notice after experiencing perinatal loss is they'll have a lot of thoughts of blaming themselves or blaming other people. They might have thoughts of what could I have done differently or how could things have played out differently.
Or how would it be if something turned out differently? Like, what would it be like to have a child right now? Or what would it be like if I was pregnant right now? I wish I was. And there's consistent reminders, especially on anniversaries, or, if you were pregnant and you had a specific due date and that day comes and goes and you don't have a child, there's a lot of triggers and moments that will continue to bring up these kinds of feelings.
Soon after the event happens, a lot of times people can notice big changes in their sleep, in their appetite, in their mood, and that is really common and normal as well.
That the emotions that come with it will often come in waves. Like they'll have waves of sadness, and then they might feel a little bit better, and then waves of anger that come in, and maybe they're sad again. Then it kind of just ebbs and flows over time.
What is not normal are things that are a little bit more concerning, and when you should probably seek treatment are when you're constantly feeling down and depressed and you aren't able to really experience joy or enjoy other moments.
Right. So that we would consider, based on the timing, of course, that you might have entered into a depressive episode, or you're experiencing anxiety, or even something like PTSD.
Yeah, these situations are oftentimes triggers for other mental illness coming up because you're going through such a big stressful event.
So, okay, what would not be normal if you're not able to enjoy anything, if you're really having difficulty sleeping over an extended period of time, changes in your appetite, feeling really on edge for an extended period of time. Of course, suicidal thoughts would be something.
Suicidal thoughts, definitely. And if you're noticing that things just aren't getting better over an extended period of time either.
Right, so we talked about anniversaries and, important dates around the loss. So there might be kind of a general improvement, like, okay, I've been doing better for a couple of months, and then we have the anniversary come, and of course you're having some grief around that day. But there should be kind of a general trajectory that you're doing a little bit better over time. And if you're not, it might be a time you want to seek professional help.
And even if you feel like you are adjusting well or things are adjusting normally as we described, support groups and doing individual therapy can be really, really helpful for processing what you've been through.
So the help that's helpful, we just want you to know this is really common experience, and you're not alone in what you're experiencing. Please comment, subscribe, share with your friends who need to hear this message. We'll see you soon.
Bye.